As we grow older, visiting the doctor becomes a regular part of life. But have you ever wondered what doctors really think about older patients? Let me tell you something that most doctors will never admit out loud. Older patients are loved and respected, yes, but behind the clinic door, there are things. Some of these thoughts are practical. Some are unfair. And some are painful to hear. But they're real. So today, I want to take you on a journey into the doctor's perspective. We'll uncover the 6 shocking truths that doctors secretly think about older people. Each truth will be told with real stories because these are not just ideas, they are experiences that seniors face every single day. Some of these may shock you, some may feel familiar, but all of them are important to know because your health, your respect, and your dignity matter. And let me tell you this, the last point is the most eye-opening of all. So please stay tuned until the end. Now, let's begin. Number 1. Doctors often say, "It's just old age." When seniors complain about pain, weakness, or forgetfulness, many doctors quickly brush it off as normal for your age. But here's the truth: not every symptom is simply aging. Some issues are treatable conditions in disguise. Fatigue could mean anemia. Joint pain could mean arthritis or osteoporosis. Memory loss could be due to vitamin deficiency, not just age. Labeling everything as old age delays proper treatment. Now I tell you about Harold, 75 years old. He started losing weight and feeling weak all the time. His doctor smiled and said, "Harold, that's just what happens when you get old." Trusting him, Harold ignored it. Months later, his daughter pushed him to see another doctor. Tests revealed diabetes, something that could have been managed earlier. Harold lost precious time because his symptoms were dismissed as aging. If I had known earlier, I would have told myself, not everything is just old age. Ask more questions. Push for tests. Don't accept easy answers. That's why you should never accept the phrase, "It's just old age." Your body deserves attention at every stage of life. And before we move on to the next truth, let me pause here. If you believe seniors deserve better care, please support this channel by subscribing. It helps us create more content that empowers older adults like you. Number 2. Doctors sometimes see seniors as near the end. This is the harshest reality. Some doctors unconsciously see seniors as people who are near the end of life, so they don't always recommend advanced treatments, surgeries, or therapies. Instead, they focus only on comfort care. While comfort is important, every person, no matter their age, deserves the option of proper treatment if it can improve their life. Now I tell you about Eleanor, 80. She had heart problems, but her doctor said, "At your age, it's not worth doing surgery. Just rest and take these pills." Her family pushed for another opinion. The new doctor offered a treatment plan, and Eleanor lived many more active years. She traveled, played with her grandchildren, and enjoyed life, something the first doctor didn't even give her a chance for. If I had known earlier, I would have said, "I may be older, but my life is still worth living. I deserve every chance to stay healthy and happy." Number 3. Doctors sometimes give more importance to younger patients. In crowded clinics and hospitals, younger patients often get quicker attention and more detailed explanations. Why? Because doctors sometimes believe younger people have more years to live, so they see their care as a higher priority. This can make seniors feel invisible, like their time and health don't matter as much. Now I tell you about Mr. Stephen, 79. He went to the emergency room with chest pain. A young man in his 30s came in after him with a similar complaint. Guess who was seen first? The younger patient. Mr. Stephen sat waiting, anxious and scared. By the time doctors reached him, the pain had worsened. He survived, but he felt deeply hurt, not just in his body, but in his dignity. And this truth leads us to another painful reality: sometimes, doctors don't take seniors' words seriously at all. Number 4. Doctors may not take seniors' complaints seriously. Many older adults say they feel invisible at the doctor's office. They describe their symptoms, but instead of listening closely, the doctor interrupts, assumes, or speaks to their caregiver instead. This makes seniors feel unheard. Now I tell you about Grace, 74. She had severe headaches, but when she tried explaining, the doctor kept cutting her off, saying, "It's probably just stress or age." Worse, he spoke more to her daughter than to her. Later, when Grace visited another doctor, she was diagnosed with hypertension, something serious, but manageable. If her voice had been heard the first time, she could have started treatment earlier. When doctors don't listen, seniors lose trust. But there's another hidden truth that can make this even worse: medications themselves. Number 5. Doctors often prescribe too many medications. Seniors are often prescribed multiple medicines, sometimes 5, 10, or even more. While some are necessary, many are added without checking how they interact. Too many pills can cause side effects like dizziness, confusion, or even falls. Doctors may think, "That's fine, the patient is old anyway," instead of carefully reviewing what's truly needed. Now I tell you about Robert, 82. He was taking 9 different medicines. One day, he fainted at home. His daughter rushed him to the hospital. After checking, the new doctor said, "He's overmedicated. These drugs are clashing." Once unnecessary pills were stopped, Robert felt stronger and clearer. For the first time in years, he realized he had been suffering not from age but from too many medicines. And now, the final and most important truth, the one that seniors rarely hear but need to know. Number 6. Doctors assume seniors won't follow prescriptions. Many doctors quietly believe that older patients won't take medicines properly. They assume you'll forget doses, mix up pills, or ignore lifestyle changes. This stereotype can make them less serious when giving instructions, or they may even avoid prescribing useful treatments. Now I tell you about Clara, 68. She had high blood pressure. Her doctor gave her a prescription but said, almost laughing, "Make sure you don't forget these pills, though people your age usually do." Clara felt disrespected, as if the doctor had already decided she wouldn't manage her own health. But Clara was disciplined. She set reminders on her phone, kept a pill box, and followed her routine strictly. When she returned months later, her blood pressure was under control. The doctor was surprised, but Clara thought to herself, "Why did he doubt me in the first place? If I had known earlier, I would have said, yes, I may be older, but I can still take care of myself. I deserve clear guidance, not doubt." But now, you know the truth. You can ask questions, demand respect, and make sure your health is never ignored. So, my friends, these are the hidden truths about how doctors sometimes view older patients. Now let me ask you, have you ever felt like your health concerns were brushed off as just old age? Or have you ever been given less importance compared to younger patients? Your story matters. Share your experiences in the comments below, not only for me, but so that other seniors can read them, learn, and feel less alone. If this video opened your eyes or gave you something to think about, don't forget to give it a like. It really helps this channel grow and reach more people like you. And if you haven't subscribed yet, what are you waiting for? Hit that subscribe button and stay with us, because I have many more videos coming, with real stories, simple advice, and honest truths about senior health and wellness.